On Thursday, the United States Senate rejected a pair of health care bills, one from each party, that would have delivered relief to more than 20 million Americans before the end of the year. It appears now cost-saving subsidies added to the Affordable Care Act in 2021 are likely to expire on New Year's Eve, causing patient prices to increase by as much as 100%. So is there any hope for an 11th hour solution? And why is the cost of health care rising so fast? NBC's Thompson has our Sunday focus.
15 years ago, President Obama lauded the Affordable Care Act as a historic achievement.
And we have now just enshrined, as soon as I sign this bill, the core principle that everybody should have some basic security when it comes to their health care.
Nicknamed by friends and foes as Obamacare, it cut the percentage of uninsured Americans in half, a favorite target of President Trump. It survived countless repeal attempts and remains a source of contention on Capitol Hill. Healthcare subsidies for Obamacare at the center of the government shutdown, and this week, no deal in the Senate.
The motion is not agreed to.
Republicans have all but guaranteed that tens of millions of people will see their premiums double or triple or more.
Democrats want to extend the subsidies for 3 years. Senate Republicans want to replace them, giving people up to $1,500 to put in health savings accounts to buy insurance.
We're miles apart. They want policies with a $6,000 deductible, and we want to put thousands of dollars into an account.
As they fight, Kenny Capps, who's battled a blood cancer called multiple myeloma, worries.
Do you think you would still be here if you didn't have insurance under the ACA?
Not at all.
For 10 years, the small business owner has bought health insurance through the ACA. It's paid for a blood marrow transplant, chemotherapy, and other treatments that now have him in remission. But the cost to cover himself, his wife, who was recently diagnosed with breast cancer, and their 7 children may soon triple.
What do you pay now, and what could you pay come January 1st?
So right now, our monthly household insurance is about $800 per month. After January 1st, it will jump to a little over $2,300 per month.
Can you afford that?
No, we really can't.
Others may simply choose to go without.
What's at risk here is backsliding on that progress.
Larry Levitt is with the nonpartisan healthcare policy organization, KFF.
By allowing the subsidies to expire, could this be the death knell for the Affordable Care Act?
This would return the Affordable Care Act to the way it existed before the COVID pandemic. So premiums would go up for people. Many people would lose coverage, people who have gained it in recent years. But this would not mean the death of the ACA. It would just be smaller and help fewer people.
Help Kenny Capps wants from Congress.
My hope is that they recognize there is time, not much, but there is time to correct this, to address the real challenge that's getting ready to hit this country and hit families like mine.
And Ann joins me now live. Ann, good morning. We just heard senators pretty well resigned to defeat on this. So is there any movement on Capitol Hill for an 11th hour solution before 22 million people lose those subsidies?
Well, Willie, I'm happy to tell you that this morning there is a glimmer of hope, and it comes from House Speaker Mike Johnson. He says he hopes to get the House to vote on a new Republican health care bill, this one from the House, that includes, among other things, allowing employers to join together in groups to buy insurance and therefore hopefully lower rates. It would also require more transparency from those middlemen that sit between insurance companies and drug makers and pharmacies, called pharmacy benefit managers. Now, GOP leadership aides also tell NBC News that they are working on an amendment to extend the subsidies of the ACA, but it's unclear how long that extension would be, and even if it could pass altogether, because it would face such a steep uphill climb to become law. And all this is happening as tomorrow is the deadline for people to choose their insurance under the ACA if they want health insurance to start on January 1st. Lots of moving parts, Willie.
with the clock ticking as well. 2.5 weeks to New Year's Eve. Ann, thanks so much for a look at this. We appreciate it.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.